Hello and welcome to WION Live Broadcast from London. I'm Ollie Barrett. Let's take a look at the headlines this hour. French President Emmanuel Macron issues a provocative warning to those still unvaccinated in France, saying he plans to annoy them by making their lives more difficult. The US, Britain, France and Australia all announced record numbers of daily COVID infections as the WHO warns that Omicron's spread has also increased the risk of newer, more dangerous variants emerging. Hong Kong announces a ban on flights from 8 countries including the US, UK, France and India after an Omicron outbreak linked to an aircrew. China urges caution after North Korea fires a suspected ballistic missile off its east coast in the first launch of 2022. South Korea and Japan raise concern and call for dialogue. The decision to grant Novak Djokovic a medical exemption against the need to have a COVID vaccination. Tennis Australia maintains no special treatment was afforded to the men's singles world number 1. The French president has raised eyebrows with his choice of words about the unvaccinated in his country. In an interview to the Le Parisien newspaper, Emmanuel Macron declared his government's strategy for unvaccinated citizens effectively boiling down to making their lives more difficult. And as you can see, he used some fairly provocative language. French opposition politicians are demanding an explanation. The backdrop to all of this was the French Parliament debating a new law which would allow vaccine passes only for fully vaccinated citizens. The key debate on the government's strategy had been postponed after several hours of chaotic discussion on Monday. The far right and far left are against the vaccine passes, calling them discriminatory. Lawmakers have proposed hundreds of amendments to the bill, which will go to the Senate later this week. President Emmanuel Macron's centrist party has a majority in the lower house and his government wants the law to enter force by January the 15th. The pass will keep access open to indoor public places such as cafes, restaurants, cinemas, museums, concert venues and sports centres, as well as to public transport and flights for those who are fully vaccinated. France has vaccinated almost 90% of its population, and the French president says only a very small minority is resisting. The Swedish royals are among the latest victims of COVID-19. The Swedish royal courts confirmed that Gustaf of Sweden, King Carl XVI and his wife Queen Silvia have tested positive for the coronavirus. The King and Queen are in their 70s and were fully vaccinated along with booster shots. Both of them have mild symptoms and have isolated in the home according to the current rules of conduct and infection tracking in the country. The King and Queen of Sweden have joined a growing list of European royalty who've tested positive in recent weeks. That includes Crown Princess Mary of Denmark, Princess Beatrix of the Netherlands and Princess Anne of Britain. Meanwhile, in Germany, the government is considering tightening existing restrictions on social contact. Chancellor Olaf Scholz is due to meet regional leaders to discuss the response to the spread of the Omicron variant. Daily infections in Germany have been declining since December after the introduction of tight measures, but Germany has a relatively low rate of vaccination compared with other Western European countries. A little over 71% of the population is fully vaccinated. 39% have received a booster shot.
Well, if I were to just write it on Facebook, nobody would notice it. And my job is to have company teams leading some 1,000 sheep from A to B. And I have noticed how enthusiastically the sheep are received and that it simply reaches people deep inside, which is perhaps not possible rationally with rational argument.
Well, we can cross now to our correspondent Trent Murray, who's joining us live from Berlin. And a good place to start, Trent, would be with the infection case number situation in Germany. I was talking about how case numbers had declined since December, but recently there's been concern about Omicron, just like we've seen in other countries.
Yeah, that's right, Ollie. I think like much of Europe, leaders here are seeing a bit of a jump in the data and are now trying to chart a new course forward with Omicron. You are right, Germany had seen a bit of a plateauing, if you like, of its COVID data. But what we are now seeing over the past few days is that things are starting to tick up once again. The latest numbers from today suggest that there are close to 59,000 new infections. Now, that is about a 47% increase compared to the same day last week, clearly showing things are going back up in the wrong direction, if you will. And the health minister here, in fact, says the number is likely to be much higher. And that is because there is still a backlog from the Christmas and New Year period when a lot of local health authorities took some time off and were not reporting data daily. And so he thinks that, in fact, it could be 2 to 3 times higher. And he's concerned that the federal health ministry now doesn't really have a very clear picture of the COVID situation across the country. Speaking in the past few hours, Karl Lauterbach has said because of that, a further tightening of restrictions is likely for Germany. But in order for that to happen, he will have to get it past 16 regional leaders right across the country. They will all be meeting on Friday with Chancellor Olaf Scholz to wargame where to take Germany next in its fight against COVID-19.
Well, let's go there then, Trent. What exactly are those leaders going to be discussing in terms of possible new restrictions, and what chance we see them agreed to by those leaders?
Well, it's a very good question, and I think it's one that a lot of German people will be asking, because Germany really has been the opposite, I suppose you could say, in being bullish with COVID rules. It really has kept pretty strict regulations in place now for close to 12 months. I mean, things like masks have been mandatory in most public spaces for about a year. Vaccine passports have long been required to go to restaurants or bars or the gym, even now to ride public transport. So in many ways, there are fewer and fewer levers, I suppose, to pull for legislators when it comes to COVID restrictions. There is some discussion that a controversial vaccine mandate could be on the cards. Certainly when Chancellor Olaf Scholz was sworn into office last month, he suggested that was something that he would support. Obviously, a controversial move, essentially forcing people to be vaccinated, but that is one measure that is being considered. But what we have seen over the course of this pandemic is that getting agreement on some of those big questions can be difficult. It's hard enough when you've got a government of just your own party making these decisions, but it's worth remembering the change of government in Germany over the past month or so now sees a coalition of three separate parties: the SPD, which is the traditional centre-left one, the Greens, and then this kind of small government pro-business FDP. All have got quite different views on how to tackle the pandemic, and so it will be a difficult next couple of days, I would say, for Olaf Scholz as he prepares both the regions and his own federal government for possible restrictions.
OK, Trent, thank you. That's Trent Murray reporting for us live from Berlin. Next to the United Kingdom, where the country is reporting over 200,000 COVID-19 cases on a daily basis now. But despite an increase in the number of infections, Prime Minister Boris Johnson says the country can ride out the latest Omicron wave without needing a further lockdown or indeed any tougher measures. He's meeting his cabinet on Wednesday to confirm that England will maintain its Plan B measures, which include a vaccine booster drive and maintaining caution among the population.
Together with the Plan B measures that we introduced before Christmas, we have a chance to ride out this Omicron wave without shutting down our country once again. We can keep our schools and our businesses open, and we can find a way to live with this virus. But the weeks ahead are going to be challenging, both here in the UK and across the world. There is no escaping the fact that some services will be disrupted by staff absences.
Those Plan B measures were introduced in England last month and don't include restrictions on gatherings or shutting down businesses. Speaking from Downing Street, the UK Prime Minister also said that the latest variant of COVID-19 is milder than previous variants, further reiterating the mitigation of the virus with booster vaccines. The UK Parliament returns from recess on Wednesday, but Labour leader Keir Starmer won't be there. He is isolating after testing positive for COVID-19 for the second time in weeks. Australia's daily COVID cases have hit a record high for the third consecutive day, further straining hospital resources and testing facilities. Handling of the fast-moving Omicron outbreak has become a potential crisis point for the Scott Morrison government.
Australia's COVID-19 cases soared to a pandemic record on Tuesday. The Omicron variant has ripped through most of the country. Hospitalisations have risen drastically, and a once formidable testing regime is buckling under lengthy wait times and stock shortages. Australia used a constant testing system for a year and a half, along with contact tracing and lockdowns to squash most outbreaks. Political leaders have pointed to a largely successful vaccination rollout and few deaths relative to new case numbers. But Prime Minister Scott Morrison's fiercest political competitor, opposition leader Anthony Albanese, says it's not good enough.
So you can't get a booster shot, even if you have an appointment. You can't get access to a PCR test because testing sites are closing and the queues go for 6 or 8 hours. You get told to get a rapid antigen test, but you can't find one. If you do find one, it's not affordable, and they won't do anything about price gouging. That's the record of this government.
Political leaders countrywide have been reshaping their messaging on COVID. After nearly 2 years of campaigning for widespread testing, authorities now ask asymptomatic people to bypass overburdened government-funded clinics and take their own rapid antigen tests. But that has brought a new pressure point, an explosion in sales of home testing kits. That's led to reports of stockpiling, empty shelves and inflated prices on the few kits which have not yet been sold. Morrison has ruled out subsidising the testing kits, citing a heightened role for personal responsibility, though the country's competition regulator plans to investigate complaints about allegations of price gouging. Despite the spike in infections fueled by Omicron, dual-dose vaccination levels of nearly 92% in people above 16 have helped Australia to keep the death rate lower than in previous virus outbreaks. Around 2.5 million Australians have also received booster shots so far. Regardless of the soaring numbers, the number of deaths in Australia are still lower than those seen in many developed countries.
Next to China, where the city of Zhengzhou has ordered 12 million residents to take COVID-19 tests. China's been ramping up measures to stamp out virus clusters ahead of the controversial Winter Olympics. Authorities have ordered everyone to be tested to uncover infections hidden among the public. The number of cases in the city of Xi'an has fallen to its lowest in weeks. Officials say that outbreak has been brought under control. Xi'an has a population of 13 million. Residents have been under stay-at-home orders. The Deputy Director of Shaanxi Province's Health Commission says the epidemic is showing a downward trend. With less than a month to go until the Winter Olympics, the country is witnessing small outbreaks, and that's putting pressure on the administration's COVID strategy. Local authorities deemed to have failed to prevent rising cases have either been sacked or punished. This includes 2 senior Communist Party officials in Xi'an. They were dismissed over what authorities called insufficient rigour in preventing cases. China will host the Winter Olympics from February the 4th, and the country will implement some of the strictest rules seen for a mass sporting event. All athletes, officials, staff and volunteers will be within a closed-loop system for the duration of the Games. This is to separate them from the public. The United States is also recording a sharp increase in cases blamed on the Omicron variant. But top US infectious disease expert Dr. Anthony Fauci says that since the Omicron variant causes fewer or no symptoms in many people, it's more relevant to focus on hospitalizations it causes and not the total number of cases. This comes as the number of new cases per day has more than tripled in the US in the past 2 weeks. The country now averages 480,000 cases a day. Some schools, hospitals and airlines are struggling to cope as workers are either infected or in isolation. Hospital admissions average over 14,000 a day in the last week. That's a 63% rise on the week before. Deaths have been stable over the past fortnight at around 1,200 a day. And while that's lower than the all-time high of 3,400 last January, remember that last year the vast majority of the US population was unvaccinated. The United States has meanwhile doubled its order of Pfizer's COVID pills, bringing the government's total order to 20 million so far. The antiviral pill called Paxlovid has proven highly effective in reducing the intensity of illness when taken as soon as symptoms start. President Biden says the pills are a game changer and have the potential to dramatically alter the course of the pandemic. He also has this message for the unvaccinated.
You know, we've reduced the number of American adults without any shots from 90 million to about 35 million in the past 6 months. But there's still 35 million people not vaccinated. And let me be absolutely clear. We have in hand all the vaccines we need to get every American fully vaccinated, including the booster shot. So there's no excuse. No excuse for anyone being unvaccinated. This continues to be a pandemic of the unvaccinated. So we got to make more progress.
Well, as the world tackles the surge in COVID infections, the World Health Organization says that as the Omicron variant spreads and replicates further, it becomes more likely there will be new variants which could be more dangerous.
We're still at a phase where the virus is evolving quickly. The more it spreads, the more it transmits, and the more it replicates, the more likely it is to throw out a new variant. Now, Omicron is lethal. It can cause death. It can cause hospitalization, maybe a little bit less than Delta. But who's to say what the next variant might throw out? So we're not at a situation yet of being able to count on herd immunity. We need still to have the same approach. The strategy stays the same.
That warning comes after the WHO said there was more evidence that the new variant is indeed milder than previous ones. Latest studies suggest Omicron is affecting the upper respiratory tract, causing milder symptoms.
We are seeing more and more studies pointing out that Omicron is infecting the upper part of the body, unlike other ones, the lung, who has been causing severe pneumonia. It can be a good news, but we really require more studies to prove that. We had a good number of studies coming up, proving again what we heard from South Africa, that the vaccine still protects you against hospitalization and severe disease and death. And that's what vaccines were designed. The challenge has not been the vaccine, but the vaccination and reaching those vulnerable populations.
The WHO also says Omicron's high transmissibility means it will be dominant within weeks in many cities and countries. This could pose a major threat in countries where a high proportion of the population remains unvaccinated. On that issue of whether the world will need an Omicron-specific vaccine, the WHO says global coordination is needed to take such decisions and that it must not be left to the commercial sector alone to decide. The world's oldest zoo, the ZSL Zoo in London, commonly known as London Zoo, has begun its annual census. It's a process where the zookeepers take a head count of all the species, new and old, and there are a lot of them. We'll leave you with this. Thanks for watching. I'm Ollie Barrett. Do stay tuned to WION World is One.
It's January 2022. The staff at Zoological Society of London have taken out the clipboards, calculators and cameras. For the traditional annual head count at the world's oldest scientific zoo. It's called the ZSL London Zoo Annual Stocktake. A time when the zookeepers begin a head count of every single mammal, bird, reptile and invertebrate. The zoo holds more than 400 species and the count can take up to nearly a week. Apart from keeping a count, the annual stock taking is also a part of the zoo's license requirements.
So today is the annual stock take at ZSL London Zoo. The reality is we count the animals every single day, it's part of our job, but we also do a slightly more official one once per year, which is part of our zoo licensing. And it's also a really important time for us to reflect on the concept of counting animals. It's really easy to count animals at the zoo in their lovely, safe environment, but it gives us a chance to reflect on the relevance of counting animals in times where wild populations are dwindling so much.
For some zookeepers, the task is easier than others, depending on the kind of animal they are dealing with. The penguins seemed curious about the head count, but they made things more difficult for the staff by turning up all at once. And the Asiatic lions turned into snuggly felines, making the zookeeper's task a playtime by rolling over for belly rubs. Calmer animals like Bactrian camels, Galapagos, tortoise and sloths were easy to count. But animals like monkeys had to be busy with play tools, in this case an abacus.
How's everyone doing with school, monkeys?
So the keepers could do their head count. While the squirrel and Columbus monkeys showed their math skills. After the annual audit of more than 400 species, the data will be shared with other zoos around the world. The ZSL Zoo in London had lost over £20 million during the lockdown last year. But it survived due to donations contributed by the people and a great number of visitors after reopening.
COVID had a massive impact on London Zoo. A lot of people don't realise that we're a charity, we don't get government funding, so we lost well over £20 million. We were incredibly grateful because so many people contributed through donation and still are. It's still possible to donate to the zoo to get us out of that financial hole that we were in. One thing though that we've noticed is that the visitor behaviour is changing. People want an outdoor experience, and that's exactly what London Zoo is. So our visitor numbers have actually been quite healthy, and we're expecting them to be relatively robust through this winter as we then move into what would normally be our peak season of spring and summer.
The newcomers this year were a Sumatran tiger cub, an Asiatic lion, a young sloth, 3 snappy big-head turtles and 3 baby eastern black and white colobus monkeys. Bureau Report, WION World is One.
This is right, Arab.